Oral cancer often begins with subtle changes. If you notice persistent white or red patches, ulcers that don't heal within 2 weeks, or unusual lumps in your mouth, it could signal early-stage oral cancer. These lesions are frequently painless initially, which leads many to ignore them. According to the Oral Cancer Foundation, 54,000 Americans will be diagnosed this year alone. Early detection increases survival rates from 50% to 90%. When discovering suspicious symptoms, 78% of people turn to internet searches before consulting doctors. While WebMD and Mayo Clinic provide reliable information, self-diagnosis often causes unnecessary anxiety. Key risk factors to research include tobacco use, responsible for 85% of cases, HPV-16 virus, now causing 70% of oropharyngeal cancers, and chronic alcohol consumption. Remember, only biopsies provide definitive diagnoses. A proper oral cancer screening takes less than 5 minutes. Dentists use bright lights and gloved hands to examine all oral tissues: lips, gums, tongue, top, sides and underside, cheeks, palate, and throat. They look for abnormalities in color, texture, or mobility. The American Dental Association recommends annual screenings for all adults, with high-risk patients needing biannual checks. Surprisingly, 10% of oral cancers occur in patients with no known risk factors. A biopsy remains the gold standard for diagnosis. Brush biopsies collect cells non-invasively, while scalpel biopsies remove tissue for lab analysis. Pathologists examine cellular changes using the WHO's grading system: mild, moderate, or severe dysplasia. Recent advancements include vital staining with toluidine blue, detects malignant cells, and fluorescence visualization. Healthy tissue appears green, abnormal appears dark. Survival rates drop significantly if cancer reaches lymph nodes. Receiving a cancer diagnosis triggers measurable physiological stress responses, increased cortisol levels, elevated heart rate, and sleep disturbances. Studies show 35% of patients experience clinical depression during treatment. Support groups significantly improve outcomes. The cancer support community reports 60% better treatment adherence among participants. Mindfulness techniques, like meditation, can reduce stress biomarkers by up to 40%, according to Johns Hopkins research. Treatment depends on cancer stage and location. Early stage, 1 to 2, may require only surgery, while advanced cases, 3 to 4, need combined surgery, radiation, and chemotherapy. Robotic surgery now allows precision tumor removal with smaller incisions. Proton therapy targets tumors while sparing healthy tissue. Immunotherapy drugs like pembrolizumab show promise for recurrent cases. Nutritionists create customized meal plans to combat treatment side effects like mucositis and dysgeusia. Surgery for oral cancer often involves tumor resection with 1 to 2 centimeters margins, sometimes requiring reconstructive flaps from forearm or thigh bones. Post-operative swallowing therapy begins immediately to prevent aspiration. Radiation therapy typically lasts 6 to 7 weeks, with patients receiving 2 doses 5 times weekly. Newer techniques like IMRT reduce salivary gland damage from 80% to 30%. Chemodrugs like cisplatin attack rapidly dividing cells, but cause temporary immunosuppression. Recovery involves managing common side effects. Xerostomia, dry mouth, affects 80% of radiation patients, often requiring lifelong saliva substitutes. Taste alterations usually resolve within 3 to 6 months. Swallowing therapy continues for 6 to 12 months post-treatment. Dental care becomes crucial. Radiation increases caries risk 5-fold due to reduced saliva. Hyperbaric oxygen therapy helps heal osteoradionecrosis in 70% of cases. Most patients return to work within 4 to 6 months. Survivors must adopt permanent lifestyle changes. Smoking cessation reduces recurrence risk by 50% within 5 years. Alcohol moderation is crucial. More than 3 drinks daily increases relapse risk 3-fold. Oral hygiene becomes paramount. Electric toothbrushes reduce plaque 21% better than manual brushing. Dietary changes include increased cruciferous vegetables, containing cancer-fighting sulforaphane, and reduced processed meats, linked to 18% higher cancer mortality. Oral cancer survival rates have improved dramatically. The 5-year survival rate for early-stage patients now exceeds 90%. Regular follow-ups catch 80% of recurrences within the first 2 years. Advances in genetic testing allow personalized treatment plans. Survivor advocacy has increased awareness. The Oral Cancer Foundation's screening events have detected precancerous lesions in 15% of asymptomatic attendees. Remember, monthly self-exams and annual professional screenings save lives.